Mayor Augustin, and my proposal is planning an EHR implementation for the William Medical Services. They are a specialty group that consists of 50 primary care physicians and specialty physicians. So it's a big part or subgroup of a hospital system called Leonard Williams Medical Center. And I'm going to just get right into it because I know you guys don't have a lot of time. So we'll start with the risk analysis strategy. Sorry, back and forth. Number one, so the scope. The scope is basically any organization or our organization that creates and transmits data. Number two, data collection must be documented. Three, identify potential threats, which, threats in privacy and confidentiality, figuring out what caused the threat and why. Access to current security measures, like what is currently safeguarding our information. That's really important in this process of EHR implementation because we have to make sure our patients' information is safe. Then we go into the likelihood of the threat occurrence, just seeing like what's the probability of this happening again. And then impact on confidentiality and integrity. So just seeing how bad was this? Did we send something to the wrong fax number, or did we give a whole nother patient the wrong information, like the value of that? And then the level of risk, is the value, the likelihood that the likelihood and the impact combined. So we can like make up a chart with numbers on there to say, okay, 0 to 5, 0 being the lowest risk, 5 being the highest. And we kind of can put the likelihood and impact together, value of likelihood and impact together to get a number that we can go by to figure out which ones are high and low risk. And then, of course, final documentation. Definitely want to make sure the risk analysis is documented. Anything that happens during this process has to be documented, has to have some type of solution from a committee, or someone will have to take accountability for that. And then last but not least, review updates and do periodic reviews, see where everything is at, what's the issues, how we can solve those. Okay, so the next thing I wanted to talk to you about is how the EMR is going to go through the systems development life cycle. Okay, so there's 4 parts to it: planning and analysis, design, implementation, and evaluation. The planning is just where you see how feasible it is. Are the coworkers or our staff members going to be, more efficient on this? Is the workflow going to be better? Are we going to prevent more mistakes? Planning everything that may go wrong and already having a solution to that problem. Design, we definitely have to make sure the architecture and the operation system is good, and this includes software, hardware, network systems. We have to make sure that all of that is together in one piece. Implementation, that's basically where the system is customized, it's tested, it's installed. We're figuring out what flaws we need to be looking out for and trying to come up with solutions and other ways of doing things with that. So the last part will be the evaluation, constant upgrades, changes in technology. We have to keep up with that. So technology has an impact on cultural factors, meaning, technology can't take human and, human to human interaction. It just takes that away. Just think about us being on Facebook, Instagram. You see your family through your device and your technology, whatever you choose, and then it takes place of you meeting with these people, having interaction. So sometimes technology can, have that divide between, just technology and you looking at somebody from a computer versus you being there face to face. And studies have shown that body language is definitely a great indicator or a helpful hint when trying to figure out what's going on with somebody and their health issues. If they're coming in with symptoms, sometimes it's just best to just see them in person, because you can note a lot more things by that. And also, who is doing what. Technology, just because technology moves doesn't mean everybody moves. So we definitely have to make sure that it's an easy, accessible electronic medical record. My 91-year-old grandmother wasn't on an iPhone 8. Like, she just, it was just, she's not going to use that. She's probably going to have, she still had a flip phone. I don't even know how she got it on. So the next thing technology has an impact on is definitely decision making, because once the system is implemented and we go live, there's instant information. There's right there live, and it's definitely quality, because we can see what a patient has had done, where they've been in the last 3 months, the last, you know, 4 medicines that were prescribed. It would just be there live, ready to go. So that's definitely how technology is going to impact this whole process. All right, so not going to go into this, but key players in strategic planning, definitely the implementation manager. This is the person that's going to manage everything, make sure everything's going smoothly, making sure everybody's meeting their deadlines, making sure the project is on schedule, making sure that if there's any events that the staff needs to go to, or any events they need to go to get more information, that's going to be the person. I put IT team just as like a group, because the IT team is just so vital. They have so much information and knowledge about these information systems that us clinical sometimes we just don't know. So you have like your EHR builder, your IT lead, your design builder, all of these people. It's just, I couldn't really pick three that I felt like was so important, because this process, everyone is important, everyone. And then, of course, your senior management. You're going to have a physician in the lead, the nurse lead, the CIO, the practice manager. These people are going to be the managers and making sure that their part is done. Enterprise-wide data's role in health information governance. Governance is just how are we going to keep all this process together and going. So managing data from many different organizations. So that's definitely going to go into, quality improvement, and how we're going to have live information right then and there from places that they've been before, that's not in the same town, or other organizations we could be connected to get this information to help make decisions on healthcare. All populations are involved, receive value from the information. That's what I just explained. Aids in healthcare decisions, which I just explained. So that's why enterprise data plays a big role in health information governance. To compare and contrast the roles of technology, to compare with enterprise-wide information, they both improve efficiency, creating a standardized, interoperable pool. Can never say that, I'm sorry. Both make more information available in a timely manner to help make decisions. Both need ongoing support and quality improvement measures. We can always be better at something, and we don't have to just, you know, say it's working. It's always something better. And to contrast, technology's roles consist of like software updates, improving consistency, reliability, usability, and then enterprise-wide information. I'm so sorry. Um, is to share, basically share amongst other health professionals. So the data is the one that's being received or sent, and technology is just the actual thing that's allowing this to happen. So our software, our privacy safeguards, all that stuff. And my computer so slow. The best practices and policies that relate to governance, information exchange, and tech technical and structural interoperability, governance, balanced governance, data quality, access to data, data literacy, data content, analytic prioritization, information exchange. You want to define your goals, meet with the physician stakeholders, include the other practitioners, like not just physicians, and operability within the hospital, and don't limit to one HIE. And then interoperability is protect privacy and security, build a culture of electronic access and use, build upon the existing health IT infrastructure, and so on. So this will all be in the proposal, the written proposal, so you guys can go through that and look at that. And then the economic impact of planning this implementation, definitely going to be big costs in the beginning, but in the end, the most important thing is quality patient care, and we will be able to be qualified for incentives. A lot of CMS guidelines are changing, and we're going to have these systems for them to reimburse to the fullest. It reduces mistakes and errors, so we can kind of save up on, other things that may come up that are costly, and efficiency in billing and coding. That's definitely been a big issue. The claims, it's just, if it's not done right, it's held up, and then we have to do all of this back work to get our money. And the questions I feel you may ask, I would say, have we invested any other solutions? Yes, we've looked into other solutions, and this is the best one and has proven to be the best. Question 2, are we using the same vendor as Leonard Williams Medical Center? Yes, of course, definitely. Contract is already and set to go if we intend to implement. And then what will our mission statement be after the go live day? I don't know. I put new beginnings or new changes, new beginnings with our patients at the forefront. So I don't really know if that's going to stick. That's just something that, a few of us came up with, but I do want to talk about it with the steering committee. Okay, so that's the end of it. You guys will get the proposal in writing. If you want to see where I got the information from, that will be included as well. Thank you and have a nice day.